Hi, I'm Jenny Gallagher with Joyful Heart House Calls, Joyful Heart Healthcare, and Keto Nurses. Some of y'all are familiar with my Facebook pages and you're following along. Some of y'all are my patients, and you hear some of what I'm going to talk about today every time we chat. But this is a common topic that I have to cover a lot with patients, so I thought, heck, I'll make a video and we'll talk about it just a little bit. So one of the things I find when I see patients is when we go through the lab results, a lot of times the sodium level is really low. Sometimes it'll be outside normal range, or it'll even be inside normal range, but it's still on the lower end. Normally the sodium range is around 135 or 136 to about 145. Not a real big range, especially if you compare it to something like vitamin D that has a range from 30 to 100. So we realize that the differences sometimes are in the measurement of the actual ingredient, but sometimes it's just the idea that we only need a limited amount. Historically, we've been told that salt is unhealthy for our heart, and that we will get high blood pressure if we consume too much salt. So I thought I'd share a few tips with y'all today about salt. A couple things in history. Go back and look at the amount of salt consumed in previous generations and groups of people. For instance, the Romans used about 25 grams of salt per day. Yes, per day. Okay. The 18th century Europeans, a lot of people who we descended from, like a lot of Europeans are what populated America. Most of the 18th century Europeans actually consumed about 70 grams of salt per day. That's a lot of salt. Of course, a lot of their salt came from seafood and just preserving their meats. Back then, there wasn't refrigeration like we know it today, and so salt was used as the preservative. Studies currently suggest an optimal range of sodium intake or salt intake should be about 1 to 3 teaspoons a day. Okay? I sort of fall in the middle of that range, and I typically recommend about 2 teaspoons for most of my patients. Okay? 2,300 milligrams is what standard medical mainstream nutrition advice, all the organizations that are out there supposedly promoting good health, recommend 2,300 milligrams per day. That's less than 1 teaspoon. It's about 2/3 to 3/4 of a teaspoon, depending on the brand and kind of salt you're using. Salt weighs differently. It's why some of the numbers you see when you look up how much salt should I consume. It's why you'll see 3 grams here or 4 grams there or 8 grams here. It also, you also need to think about whether you're actually weighing salt, okay, which is sodium chloride, or if you're talking about the sodium need. And so in general, I usually mean sodium, even when I say salt, because sodium is the most needed ingredient. We do need the chloride, but sodium is the most needed ingredient out of the pair. So basically it boils down to, if mainstream nutritional advice for the last 50 years says something is unhealthy, it's probably wrong. Like, think about it. Fats were demonized. They've turned out to be essential and healthy for us. Sugar has been recommended in high amounts. Like, you can have all the sugars and carbs you want, but it turns out it's the driver of many chronic conditions today. So it's not healthy. Think about cholesterol. Cholesterol was demonized, but it turns out it's part of our tissue repair and healing mechanism. So anything that you think you know about health and nutrition, you should question, okay? And yes, there are viewpoints supporting each perspective, but I encourage you to look up the data. There are tons of newer research and reports that are available. And so if you're wondering about authors or who puts it out and you want to know, just shoot me a message or comment on one of my Facebook posts. Watch my Facebook pages. Follow Keto Nurses and Joyful Heart House Calls. I post stuff constantly about how we got things wrong. When you look at how we got things wrong, you can run across some data that suggests that residents who live in Japan, South Korea, and France actually live the longest, and yet they have some of the highest fat intakes and sodium intakes of all peoples when you compare all of us to them. So let's talk for just a second about symptoms of low sodium intake. Number one, the biggest thing I see is fatigue. People complain of being tired all the time, and almost always I find their sodium levels are below 140 or less in their lab results when we're going over them. Muscle cramps, Charlie horses, drawing of your toes or fingers, muscle twitching. One of the most common things I see is heart palpitations. Oh, I had this little thing, this little flutter. It doesn't last long, sometimes a minute or two, sometimes longer, but almost always these heart fluttery things are related to inadequate salt or other electrolyte issues. Anxiety, stress, forgetfulness, just not feeling like you're quite all there mentally. All of those can be symptoms of a low salt intake. Think about your iodine deficiencies. Like so many experts, YouTube video experts and bloggers today are saying go to this kind of salt or this kind of salt, use a healthy salt, use a pink salt, use a gray salt. The problem is when you switch to quote unquote healthier salts, you miss the iodine. Iodine is not in any of those salts in any appreciable amounts. Yes, trace amounts are present in most of them because it's naturally there, but iodine is not added in enough quantity to any of those salts usually to provide an adequate iodine intake. So what I find in my practice is a lot of people will cut out maybe carbs, or they'll go vegetarian, they'll do whatever, but in the process of changing their dietary intake, they run across something that says, oh, don't use the blue box of chemicaled salt. And so they switch salts, not realizing that the iodine was essential to their health. We added iodine back in World War I, back when a large section of soldiers were found to be iodine deficient. They were getting sick and not well, and so we started adding iodine to salt. Everybody uses salt, so it was an easy way to get iodine in our diets. But when we start changing to a healthier kind of salt, we miss out on iodine. So I find that a lot of times people will change their dietary intake, and within about 1.5 to 2 years, they're hypothyroid because there's not any iodine coming into their system that provides enough iodine for their thyroid function. So then you wind up with an ingredient deficiency caused hypothyroidism. So iodine is essential. If you're not going to get it from your salt, if you're going to use a healthy salt, that's fine, but you have to find iodine from somewhere. I do have a blog article that I recently wrote with more details about iodine, and I'll put the link in the comments with the video. Headaches, migraines, dizzy spells, all sorts of head symptoms are often related to an inadequate salt intake. Okay? Kidney stress can be a major problem with low salt intake. And yes, I know mainstream medicine is going to tell you cut back on the salt if you have kidney problems, but I'm here to tell you that the lower the salt intake, the unhealthier your organs will be. So let's talk for a minute about some of these specifically. Okay? Number one, fatigue. If you have fatigue, start researching and finding causes. What are causes? other than low salt. Oftentimes, any illness, if you have any other diagnosis, type 2 diabetes, type 1 diabetes, you have rheumatoid arthritis or Sjogren's, or any kind of diagnosis whatsoever, fatigue is almost always associated with that diagnosis. Okay? Think about the medicine you're taking. If you have a diagnosis, you also have a medicine probably. And so look at the side effects. Use the internet to track down side effects of every single medication that you're taking. Every single one. If your side effect of fatigue is listed in probably the top 5 to 8 of the side effects, I can promise you that much of your fatigue may be coming from the medicine you're taking. So I'm not telling you to stop a medicine, but to talk to your prescriber. Go find out, like, look, I have this terrible fatigue. We've done all the blood workup and everything is normal. It's got to be causing, this medicine has got to be causing my fatigue. Okay? So look at illness as a number 1 cause, salt intake, and all of your medicines you take. Impaired oxygen to tissues is also associated with a low salt intake. If you don't have enough salt on board, then you're not going to have enough fluid, you're not going to have enough movement of circulation to get nutrition and oxygen to your body cells. Okay? Number 2, muscle cramping, Charlie horses, twitching, palpitations, poor bone health even. All of the bone muscle system relies on salt to help move fluids around. I would estimate that probably electrolyte imbalances contribute to all these muscle bone kinds of issues. Almost all of them. Salt probably accounts for 75 to 80% of these imbalances when you don't get enough salt. 75 to 80% of your muscle twitching, cramping, muscle fatigue, all of that is almost always related to a low salt intake. Probably about 10 to 15% of that is probably a potassium deficiency. Potassium is recycled in the body pretty well, unlike salt. Sodium is excreted. We cry salt, we sweat salt, we bleed salt, like we lose salt when we go to the bathroom, like every single body function loses salt. So it's essential that salt come back in on a regular basis. Potassium, probably only 10, 12, maybe stretching at 15% of the electrolyte imbalance that causes these muscle issues is related to a potassium deficiency. So not very many. Even less are related to mag. And I know I see all over social media, everybody says, take your mag. Like, it's just the opposite with sodium recommendations and magnesium. Every time somebody reports fatigue or muscle stuff, somebody will say, almost everybody will say, oh, you're not getting enough mag, take your mag. But I'm like, start with salt. Because like 75 to 80% of the time, it's inadequate salt. We're afraid of salt. We've been brainwashed for 50 years that salt's bad. So magnesium probably only accounts for somewhere between 5 to 10% of those electrolyte deficiencies, and then calcium is the lowest, probably at 3 to 5%. So most of the muscle stuff isn't magnesium or potassium or even calcium. It's almost always a salt-sodium deficiency. Okay. Number 3 symptom, cold extremities. Now, let me just tell you, the first thing if you search the internet for I'm cold all the time, or I have cold fingers, cold toes, almost all of the first things that pop up will be hypothyroidism. And it's true, cold extremities are associated with hypothyroidism, but also associated with an inadequate salt intake. Think back to what I said a while ago about getting oxygen and nutrition in the circulatory system delivered to tissues. If your salt intake is low, there's not adequate fluid balance and electrolyte balance to help move the blood and the nutrition around your body. So cold extremities will result. What else causes cold extremities? Anemia. one of the most common problems I'm finding in lab work is subtle to severe anemias. Subtle meaning it's very difficult to detect without specific tests, and severe meaning you might need a transfusion or an iron infusion. So other causes can contribute to cold extremities, but low salt intake is one of the first. So think about what's going on with your whole body. Go back through this video and take some notes and go from there. Okay. Number 4, the 4 symptom: headaches, migraines, dizziness, head stuff that we mentioned before. Again, this goes back to similar to the fatigue. Look at your illness. Most illnesses cause headaches sometimes. If you have migraines, you need to look at what's triggering, what's causing your migraine. I never had migraines until I had a hysterectomy, so I know there is some sort of hormonal component to mine. I am now able, I've had a few in the last 3 or 4 or 5 years now, and so now I'm able to see most of my migraines are triggered after an episode of either poor sleep, high stress, usually combined, and or low salt intake. Something happens, I get too hot, I work outside, I don't get enough water in while I'm working, and so those things I know are contributing to when I have a migraine. So you need to go back and look at activities. And when I say poor sleep, usually it's not the next day. Usually it's 2 or 3 days later. Like the body has compensation mechanisms to catch up and do things for us to try to help us from being sick, try to help symptoms from occurring. But not always are we going to see the trigger immediately following the response. So you have to kind of do a little homework, do a symptom diary, a food diary, try to figure out what things contribute. You may not ever find out or figure out exactly the cause, but you can find triggers. You can find contributing factors. Okay? So think about your medicines again. If you're having a headache in the middle of your day, almost every day, it's about the same time that it starts. Think about your medicine intake. Think about your food intake. What are you drinking or not drinking? Some people will have caffeine rebound headaches. If they have their coffee in the morning, they're fine until they do without their coffee, and then they have a headache because they're not getting the caffeine. Or they'll later start some caffeine again, and they'll have a rebound from using extra caffeine. So there's lots of reasons that your intake from whether it's food or medicine can actually impact your headache. Dizziness, headache, migraines, all of those kind of go in one group together. So think about your illnesses, think about your medicines, think about all of what's going on in your life. That's number 4. Number 5 symptom related to inadequate salt intake is anxiety, stress, mild forgetfulness. Forgetting where you put your keys, trying to put the mayonnaise in the pantry instead of the fridge. Like some of those little things that we chalk up to being stressed or distracted, or, we just aging, sometimes we say. But oftentimes it is from a lack of circulating oxygen or nutrition, and that backs off or dominoes down to the sodium intake. If there's inadequate sodium, there's inadequate nutrition getting to your body's parts. Okay? Think about kidney stress. If you have kidney function tests that show up on your CMP, those levels include your BUN, blood urea nitrogen, and your creatinine, and your estimated glomerular filtration rate, EGFR. Those 3 numbers are your kidney numbers. They tell us about your kidney health. If you're having 1 or 2 or 3 of those out of whack, that's what we call kidney stress. Once it's at a certain level, it's kidney disease, chronic kidney disease, kidney failure in different stages. So you want to make sure that if you're having any of those numbers, look back at the sodium number. If your sodium is low, try increasing your sodium level and see if things get better the next time you have lab done. But kidney stress is often associated with low salt intake, as well as diabetes, as well as hypertension. Lots of other chronic conditions will contribute to kidney stress as well, but so do medicines we take. Many medicines are filtered by the kidneys and stress them out a little bit at a time. Over a lifetime, that can be a lot of stress and a lot of damage that happens. So figure out what truly is causing your problem, and then you can work on what the repair might be. So that's number 6. Number 7 is the iodine deficiency, and we kind of already touched on that. But you just want to make sure that you're getting adequate salt and iodine. Basically, I tell my patients that if you're getting about 2 teaspoons of salt most days, you will get approximately the right amount of sodium that your body needs. You'll also get about the right amount of iodine your body needs. So it's a win-win. You don't have to buy anything but a cheap box of salt, and you fix both problems. So how do you get 2 teaspoons of salt? Well, I usually recommend that you measure out 2 teaspoons in the morning. Put it in a jar lid, a bowl, cup, some small container. Leave it sitting out on your counter, and every time you fix food, you pick a sprinkle up and add it to your food. Just a sprinkle, okay? If at the end of the day, the first couple times you try this, you're not getting your 2 teaspoons, then you're like, ooh, I gotta do more than that. So what I have to do is I only eat 1 or 2 meals a day. There's no way I can get 2 teaspoons of salt in 1 meal. It's hard, it's almost impossible to get it in 2 meals. That's a lot of salt in a meal. So I just can't do it. It's not tasty to me. That's too much salt for my particular taste buds. So what do? I drink my salt all day. I sprinkle it in my water, just a few sprinkles. The cool thing is your body will sort of self-regulate. So if you start with just a pinch and you start drinking on that, yes, it tastes a little odd in the beginning, but it's kind of like, that's not a bad odd. Oh, maybe I need a little more. And so your body will actually signal you to have more or less salt based on how it tastes and how your body responds. Okay, so you can get adequate salt in your day by drinking it or adding it to your food. Okay, let me check my notes and make sure I got everything covered that I wanted to talk to y'all about. So the last thing I do want to mention is there are some other benefits to salt that aren't really related to symptoms. One is that salt decreases insulin resistance. The more salt you consume, the better your insulin gets. If you are overweight, if you are diabetic, if you are struggling with PCOS, insulin resistance, metabolic syndrome, increasing your salt will help improve those chronic metabolic dysfunctions. Okay? Salt is also antimicrobial. Think about the preservative use. We use it to can meats, to can vegetables. It's a preservative agent in our food, but in our bodies, it also works as an antimicrobial for the same purposes, in the same method. So the more salt you consume, the better your body responds to immune problems and illness and injury. When COVID-19 reports first started coming out, I saw a report that talked about people with higher sodium levels tended to do better with better outcomes than those with low salt levels. So once again, we see the data coming out in different reports, the more current the reports. Old reports suggest it's bad. Newer reports with better data, better science, helps us see that we were wrong originally. So as far as the blood pressure thing, so salt actually regulates blood pressure and heart rate. Like I mentioned before, the palpitations, the muscle cramping, all of that is related to electrolyte balance. But the one thing that mainstream medicine seems to have forgotten is the sodium-potassium pump. For every single muscle contraction to occur, sodium and potassium, 2 molecules, have to cross the the cell membrane, not the blood-brain barrier, the cell membrane. So every time I blink, hundreds of sodium and potassium molecules swap places and go right back. That's what causes muscle contraction. Think about your heart muscle. It's contracting 60, 80, 90 times a minute, every minute of every day. It never gets to rest. How much sodium is your heart muscle using to keep you alive? Okay? The sodium-potassium pump is essential for heart health and muscle function. You have got to consume sodium every day to keep it functioning and your health healthy. Okay? The last thing is, or one of the last things I want to mention, is that sodium is a cleansing agent. Think about when you sweat. It feels good sometimes to work out and to get that nice sweaty, icky kind of stuff out of your pores and off your skin. You go take a shower after that and it's like, oh, that feels awesome. And so that's why, is because your cells are cleaning the outer layers of skin as you sweat. So salt is essential to health. That's what I want you to keep in mind. I want you to go back and watch this video again and take some notes. I want you to think about the symptoms you've had. I want you to think about the medicines and illnesses you have. And yes, this is not designed as medical advice. You need to consult your mainstream medicine provider, but know that they're probably going to tell you all of the same old line about how unhealthy salt is. Okay? Some decisions you have to make for yourself. Okay? But thanks for joining me for this lesson on Salt 101, and I hope to see y'all around social media.